Jenny Jokela from UIUC. And also, I think I would have to say, because Dr. Jenny Jokela is not only a leader in medical education, also in medicine, infectious disease. I think it's very important. He's also a friend to NYCU. So just to give you a brief introduction to Dr. Jokela. So she attended the University of Minnesota, both obtained a bachelor's degrees and also the medical degree. And also she finished his training in Boston University and also Harvard University. And also, very importantly, her contribution is not only to the UIUC, but also to the national level, because she participated very actively in the American College of Physicians, and also was given the highest honor as a master of the ACP. And also, Dr. Jokela joined the University of Illinois College of Medicine in 2000. So everybody knows that we have a relationship with Carle, Illinois of Medicine for the recent 3 years. But actually, before the Carle, Illinois of Medicine, there was a University of Illinois College of Medicine that spread through the different areas, including Urbana-Champaign. So Dr. Jokela was the acting dean of the regional dean in the College of Medicine in UIUC. And also, she is also served the senior associate dean for the engagement at the Carle, Illinois of Medicine. So I think because Dr. Jokela's professional is infectious disease, that everybody knows that in current time, especially in the current administration, we experience some misinformation about the vaccination and also about what do we do with encountering new infectious disease. I think today's topic is really spread through different areas, including the science, medicine, and public health, and how do we rebuilding the trust in 2025. So let's welcome Dr. Jokela.
Thank you so much for that kind introduction, Professor Albert. It's really a delight to be here today with all of you. Just want to say again what a privilege it is to be here. This is the first time that we were having and hosting this bi-directional exchange of students between NYCU and the Carle, Illinois College of Medicine. And it's an exciting new beginning, and it's something that everyone has been working on for a long, long time. So there are NYCU students in Champaign-Urbana right now, and we have University of Illinois, Carle, Illinois medical students here with us too. So that's just a really wonderful thing. So there's a lot of people to thank for making that possible, including Professor Albert and Dean Long and a whole host of people, a huge number of people, and we're very grateful to all of them for making that happen. In addition, looking ahead, it's exciting to think about future opportunities that we'll have together and a lot of the wonderful work that we'll be able to do together going forward. So this is just the beginning of everything. So thank you again for the opportunity. Now, here's a question. How many of you are medical students? Okay, we have a good group of students here. And how many are faculty? Okay, some good faculty too, so we have a good mix of people here. How many of you follow what's going on in the United States? Or try to. How many of you have questions about what's going on in the United States? I certainly do. Okay, good. Today we're going to talk a little bit about this concept of rebuilding trust. There's a lot of questions going around about vaccinations, as Professor Albert had touched on, and other issues as well. We'll share a little bit about what's happening with that, as well as touching on what's going on around the world. This will be a little interactive, and I'll be interested in knowing what you think and what your perceptions are of some of this as well. And we'll share with you some things that we can all do potentially going forward to address this issue of trust. So we'll go? Let me see. All right, I'm learning.
We can use this one. Yeah.
Okay. This one goes for it? Okay. And that, okay. All right, great. All right, thank you. Thank you, thank you. I have no financial or other conflicts of interest. And it's time to say thank you. You may recognize some images here through the slides as we go along. So you may see some familiar places. I'm going to thank you to Dean Wong, certainly, for hosting us and making this possible, but also Professor Albert, Professor Wade, Professor Haydn Chen, who some of you may know, and also my husband, thank you, husband, who's Professor Sheldon Jacobson from Computer Science at the University of Illinois. So here's what we'll talk about today, these points. So first we'll discuss where we are today regarding the issues of science, medicine, and public health. We'll also describe what's being done to support science, medicine, and public health. And then we'll talk about how physicians and scientists can address concerns in science, medicine, and public health, and specifically how, we'll be creative here, how an engineering-based medical school can help. So the question is, where are medicine, science, and public health today? Where are they in terms of issues, and how does the public and how do we think about these issues? Here's a quote from a former senator from New York, dating back to 1983. I love this quote. Everyone is entitled to his own opinion, but not his own facts, right? It's still true today, and we'll hold on to that. That's true. Sometimes it seems that perhaps this may get lost in the shuffle, but that's an important thing to come back to. So where is the world today on these issues with science, medicine, and public health? It's a little bit of a winding road, okay? It has the flavor that things are, and the discussions are increasingly polarized, and we're in echo chambers. There's a measles outbreak in the United States. Who knew? I mean, how could that be? You know, we have a fantastic vaccine, and that, how could this be happening? And the question for all of us in medicine and science is, how do we focus and how do we respond? That may be easier said than done. And sometimes it may seem like this. I don't know if any of you have seen this movie, Everything, Everywhere, All at Once, but it has that flavor. There's just so much going on in so many different directions. It's like, what do we do? How do we do this? Now, social media is one place where people engage, right? And we even have some people in government who are posting their announcements on essentially Twitter now. But I've heard many other people say social media is like the Wild West. Are you familiar with that phrase, or with what we mean by that? I mean, it's like there's no rules. It's could be kind of chaos, and it's kind of like the Wild West. Not particularly a place that I enjoy engaging on, and I think many people feel the same way, but that is a place where certainly many people do. I want to share with you a little bit of the background about measles and the MMR vaccination. So this is a map of the United States in 2009-2010. Kindergartners are required to be vaccinated before they start kindergarten. So these are 5-year-old children. And the blue areas show the states in the country where the vaccination rate is 95% or higher. And that's the level that's required to prevent measles outbreaks. So this is how things were in 2009-2010. Well, hop ahead to 2023, 2024. Look what happened. There's a lot less blue than what there was. And what's happened, the states have permitted non-medical exemptions, and so parents may request an exemption for their children. So the vaccination rates of kindergartners has dropped, unfortunately, across the country. So we've been dealing with this, and it's not new. It's not a new issue, but this is something that we're all grappling with. So today, in in 2025, here's the map on the left, the big map, the blue showing where the measles outbreaks are. It really started in West Texas, and there's a little bit in New Mexico, but you can see kind of throughout the country there's sporadic cases of measles. In many ways, it's not surprising, right? It's the most contagious of infectious disease, respiratory infectious disease that we know of out there. And when pockets drop below this 95% threshold, there's going to be measles outbreaks around the country. So in the United States, measles was declared eliminated in 2000, meaning there was no ongoing transmission as of that time. As of mid-May, there's been more than 1,000 cases of measles and at this point 3 deaths associated with measles. But you can see there's been smaller outbreaks in 31 states, 14 outbreaks, and most of the people who've gotten sick with measles have been unvaccinated or they have an unknown vaccination status. That's the challenge. That's the problem. We heard in early May that, this is a colleague of mine, Carlos Del Rio, who's at Emory, that over 2 million children were vaccinated in northern Mexico to try to prevent the spread of measles into northern Mexico from Texas. So they were doing some really good public health work there. We also know for measles there's no treatment. There's no treatment for it. The best thing to do is to prevent measles, and we do that by vaccination. That's the only way to prevent measles. Unfortunately, there's been some announcements and comments that have really delayed care. They've been false promises. Things like, oh, you can use steroids or antibiotics or cod liver oil. Well, those things don't work, of course, we know that. And that's been problematic. That's been difficult. In addition, in the United States and also elsewhere around the world, there's been increasing opposition to vaccinations and also some public health activities. There's 2 primary organizations that have been involved in this activity. One is the Informed Consent Action Network, and it's an advocacy group that has worked to loosen vaccine mandates. And this is the leading anti-vaccination group that spreads misinformation. And you can see here in blue what they're talking about. They resist public health measures such as vaccine mandates. They have a deep suspicion of pharmaceutical companies. I mean, some of these things just don't make sense. But anyway, that's my opinion. I think many people share that, but it's just all concerning. But deep suspicion of pharmaceutical companies, federal regulatory agencies like the CDC, the FDA, and they also embrace alternative medicine and natural foods. And if you're paying attention to the news or following the news, you'll hear some of these themes and some of the things that are being reported. This is a lot of the underpinnings of where that's coming from. So there is a lot of support for public health and good science, certainly in the United States. These certainly are not all the organizations, but these are some that are vociferously supporting public health and all these good science, evidence-based approaches to medicine and science and everything that we're doing. So we're grateful, certainly, for all of these organizations. Now, here's some falsehoods, and maybe you've heard about some of them, I don't know. Some falsehoods that have been reported in the mainstream news. I'll just let you read them. Have any of you heard any of these things said or repeated? I see some nods. Certainly in the United States, great to see you, students. Good. I don't know if you've heard any of these things. You probably have. But, I mean, it's amazing that these things are being stated and shared. And I will say there's one individual who has said every single one of these points. I'll leave that with you. But this is part of what we're, in some ways, combating as physicians and scientists who know better, that these things are not true. Now, here's some news. Just this week, there's a lot of things that continue to happen, and it's kind of a fast-moving target. It's like the movie, Everything, Everywhere, All at Once. So this is from Monday, that all 17 vaccine experts of the Centers for Disease Control and Prevention's Advisory Committee on Immunization Practices were fired. So these are the top vaccination experts in the United States who served on this committee to help do all these things that we're talking about down here. They review the data on vaccines, they debate the evidence and vote on who should get vaccinated and when. And then insurance companies and government programs like Medicaid are required to cover the vaccines recommended by this committee. So I'll come back to this, but this was a very dramatic thing and alarmed everybody. I mean, physicians, scientists, these organizations that I had mentioned, I had shared, people were just very concerned about this, this happening. So we'll see what happens. Now, the question is, how do we respond and what do we do about this? And there are some very positive and outspoken and accurate health influencers, if you can say. I don't know if you know who these people are, but they're just some heroes here. This person over here, oh, there we go. I like the spotlight. This is cool. Okay, Paul Offit, he's a pediatrician who works at the Children's Hospital of Pennsylvania, but he developed the rotavirus vaccine, and he's served on the ACIP in the past, and he's a very outspoken proponent of vaccinations and just a good person. This is Jokela-Rebuilding. She writes a blog called Your Local Epidemiologist. She just provides really good, solid, and thoughtful information. She had a post just the other day about the ACIP people who got fired. But again, just very thoughtful and helpful. Kizzy Corbett is now at the Harvard School of Public Health, but she worked for Moderna and helped to develop the Moderna COVID vaccine. So it's just exciting work that she's done and just really good things. This is Eric Topol, a cardiologist from Scripps, who again, he posts on social media, bless his heart, but he's out there posting just accurate information on a wide variety of topics, whether it's cardiology, he'll post on COVID, other things, but he's out there working to get good, accurate information out. So I just have a tremendous amount of respect for him. Do folks recognize this person? You guys do. Does anyone else recognize this guy? Okay, this is, some of you do. So Will Flannery is his real name, but otherwise he goes by Dr. Jokela Flecken. He's an ophthalmologist, and he's a comedian, and he makes videos, like little very funny videos. But people listen to him, and he does a good job of getting accurate information out there as well. So he's good things. This is Dr. Georges Benjamin, who's the president of the American Public Health Association, who also does some good work in getting the truthful information out. So it's good. It's all good things. Now, this was a paper I found just a couple months ago, published in Nature, that perhaps our challenge, our problem, is not the loss of trust, but the loss of influence. Maybe that's the issue. And it's like, well, what do we do about that? This group did a study doing surveys in multiple different countries around the world. And what they found is that many people place their trust in untrustworthy sources. So it's kind of like my science versus your science. And many trust non-scientists to tell the truth about scientific matters. So maybe family members, friends, that kind of thing. So their advice to all of us is that scientists, and I'll say, or physicians, need to communicate better with more relevance, emotional resonance, and empathy if they are going to compete with other sources. So I thought that was an interesting point of view. So here's a question for you, and I have some opinions or some impressions perhaps about this, but I'd like to hear from you how is Taiwan doing regarding science, medicine, and public health? Are you having to deal with some of the falsehoods like what we shared here, or thinking perhaps you're in a better place. But is there anyone who has any thoughts or impressions about that? Yes, please.
In Taiwan, I think in general, most people still believe and trust in scientists.
Yeah.
But I do notice, actually, is scientists within the community, they have different opinions. So sometimes the biggest problem for the general public is that they do not know which expert is the real expert to me. Sometimes experts will have different opinions.
Yeah.
And if you are a general person, you won't have any. If I say something bad about AI, nobody will trust in me.
Yeah.
But if Albert says something about AI, I say, whoa, he's an AI expert. So if we see two experts have different or conflicting
Yeah.
opinion, and that will be a huge issue. So back in COVID-19, and we do have some scientists,
Yeah.
famous scientists, and his opinion and his attitude really changed the public's opinion
Sure.
towards the government's policy, something like that. But compared with the situation in the States,
Yeah.
in general, Taiwanese is still deeply dependent on activism. We have high respect.
No, that makes sense. Thank you. Thank you. Was that helpful when the person that you had mentioned had spoken out then during COVID? Was that a helpful response then? Or was it a little confusing at that time?
In the first beginning, I think the COVID really bring the solidarity
Yeah.
among Taiwanese. But and then, as I mentioned, if a famous scientist shows some doubt, and then suddenly,
Yeah.
so I might say the trust sometimes kind of shaky. Yeah, it's not so grounded. But in general, in Taiwanese society, we believe in science.
Good, wonderful. Were you going to say something?
Yes,
Yeah.
I echo Chair Yang's perspective. Even in physical science, right?
Yeah.
Quoted from Albert Einstein.
Yeah.
Experts are only 90% correct.
There you
We're
go.
not always correct.
Yeah.
Even for physical science.
Right.
Medical science, I think, is something that is we talk about trust, but how to build that consensus,
Right.
which may not be 100% accurate yet.
Right.
It's the challenge today, I think, both in Taiwan and in the U.S.
Yes, right. No, excellent points. Excellent points. Any other thoughts about this? Yeah, very good. Very good. Okay. All right. So it seems that today it's harder to combat misinformation. The volume and the sources have increased, and there's a lot of multiple platforms out there, right? It's just a little bit tricky. I think in addition for us in the United States, what you described was probably part of what we experienced too, where you have some, we know within medicine, very well-respected expert who had provided advice, gave impressions, interpretations of data, but then there were other scientists who took opposing views for whatever reason, and in part that may be part of how the scientific method works, and that confused the public, and here we are. It's a little bit tricky. It still seems like the Wild West a little bit. All right. So here's another scene that may look familiar to you here, but we'll now move to describe what's being done to support science, medicine, and public health. So one thing that has been done, and this website, and there's some papers associated with it, represent the work of this research group out of Europe, where they were educating and working to pre-vaccinate people, to share techniques that are used to disseminate health disinformation. So the thinking being, if we know what techniques are being used, it will help us better prevent ourselves from being contaminated, if you will, or swayed by mis and disinformation. So, for instance, one technique that is commonly used is emotion, right? So outrage equals engagement, and engagement's what's rewarded on these social media platforms, and emotional language goes viral, as I think we all know. Conspiracy, to suggest conspiracy theories, is another technique that's used to promote mis and disinformation. Another one is fake experts, and it's very easy to be blinded by degrees or medical terminology, even if it's not true. So it's important for us to critically review the experts and the technology, whatever it may be, the phrasing that's used, just to be confident that it's correct and accurate and it's not fake. So here's another question for you. So here in Taiwan today, in 2025, what efforts are underway here to support science, medicine, and public health? Are there any that you can think of, or that you or that come to mind? Any thoughts? Yes, please.
Be just like what you mentioned, conspiracy. And so during the COVID period, every day the dean of the government department will have a I don't know how to describe it, on TV shows, and a news conference, and tell everybody that how many people are maybe died today, and how many people are new cases, and so we have more knowledge about this disease and know how to protect ourselves. So I think it's a really good way to give public the correct information.
Accurate information.
Yes, thank you.
Any other thoughts about what's going on here to help promote science, medicine, and public health, if anything?
I want to add that because there's a special history of our university. Actually, our the first class of School of Medicine, one of the alumni, he actually is our former president of the National Yangming University, and he is also the founder of the CDC in Taiwan. So that's and also the director of the CDC is also our alumni. So
nice.
they did a very good job to support the accurate information to the media.
Wonderful.
Yeah.
Wonderful. Very good. A lot for NYCU to be proud of there. Very good. As I was looking to answer this question, this is one thing that I found. Now, I don't know if any of you are familiar with this, but there's this group, Fake News Cleaner, that they're working with seniors especially to help battle fake news, if you will. Is this still happening? Does this still take place? Yeah? Is this a helpful thing? We don't. We'll talk later. But this is one example of something certainly that I had come across. Here's a few other examples of things that we thought were kind of interesting. One, here, public education in Finland. All right, and this was on a TV show in September this past fall. They're educating fourth graders how to identify mis and disinformation in public school. Isn't that interesting? What a clever idea. But they think it's important for democracy to do this. So that's one thing. The World Health Organization certainly is doing good work in this way and focusing on the importance of vaccination, as we know. There's a lot of good work that the WHO does around the world. And then also universities. Certainly in the US, this has garnered a lot of attention, but Harvard University and others are really looking to protect their academic integrity of what they're doing and really working hard in that way. And we'll see how this all unfolds going forward. At the University of Minnesota, there's another interesting project going on. They have a Center for Infectious Disease Research and Policy. So in April 2025, because of concerns that they had of what may happen to that committee, where everybody was just fired, they established this vaccine integrity project. So bringing together experts who have served on that committee before, but national vaccination experts, to be able to create and put out accurate information, and to be able to be viewed as a source of accurate vaccine information in case there may be other foci of misinformation there. So we'll see how this unfolds too, but they post regular news updates and things, and now that the committee's been disrupted, we'll see what they end up doing in that regard too. But I'm encouraged of that by this work that they're doing. A lot of medical journals and medical journal editors have been publishing concerns and being outspoken about this. And these are just some of the papers that have been published touching on these issues. A couple that are especially, they're all interesting, they're all good. This paper up here at the top was published in 2024, and that's a policy paper on the importance of accurate scientific information. So this was before all these other things were happening. This next one is from IDSA, the Infectious Disease Society of America, but just again talking about the role of scientific and medical journals in all of this. And then two that more recently that I especially liked is this one, Damage Control in the Wake of Political Action That Threatens the Integrity of Medical Research. They were the journal editors there who I know well, Christine Lane, but they were describing the challenges they had in that sometimes they have not been able to reach authors of papers because the authors worked in government agencies, and it's just all convoluted. But they describe in pretty careful detail what the challenges they're having addressing some of the publishing related issues. And then this one, I love this article. The U.S. Founding Fathers recognized the benefits of immunization. And so they talk a little bit about the history of vaccines in the United States, but the other thing they did in a very proactive and thoughtful way is they published the immunization schedule, both for adults and for kids. And this was published just a couple of months ago, but the concern was that in case the immunization schedule was taken down from the federal websites, it will remain here in the medical literature. So it's there and it's protected, if you will. And then this last one was published recently in The Lancet. So this has been garnering a lot of attention around the world, not just in the US, but a lot of attention around the world to support what we know is important and what works. So here's some other breaking news. So I told you about how on June 9th, everybody on that committee was fired. Well, it just so happened, as a coincidence, the American Medical Association was having their annual meeting in Chicago at that time. And in fact, if we weren't here, that's where I would have been. That's okay. So we talked about this at lunch a little bit yesterday. So at the annual meeting on June 10th, which was Tuesday, they passed an emergency resolution, which was brought forward by the American College of Physicians. And this emergency resolution asks that the decision be immediately reversed to fire those 17 people. But then they also boldly called for the Senate, the U.S. Senate, to investigate the Secretary of Health and Human Services. And it was very kind of forthright, right out there, and this was very strongly approved, and it kind of flew through the House of Delegates and the American Medical Association. And then Jason Goldman is the current president of the ACP. I know Jason well. He's a friend and a colleague, but this is what some of the things that he was saying, and he was quoted in the media and whatnot. I showed right, you guys, the X video that was there. But anyway, he said, "We do not want to be on the wrong side of history. Take a stand, fight for what we believe in, and ask the government to do their job." So just very forthright. It's like, wow, Jason, great. Okay, so again, we'll see what happens with all of this. So here's Catalina that I had mentioned briefly earlier. She posts short blog comments on Substack, if you're familiar with that. She posted one May 1st, meeting with the Make America Healthy Again grassroots, but just talking about how important it is for us to connect across, across the divide, but perhaps across, from different perspectives, but to really try to better understand where people are coming from. So, and what they came away with was to fight for people, not institutions, and also to meet questions with empathy, not to shame people or anything like that, but to really try to understand where people are coming from and what they're doing. Here's Paul Offit again, the pediatrician. He also posts on Substack, and he's also active on social media, on X, and also Blue Sky. But this is one post that he had written and posted back in April, and he's he dealt with the measles outbreak in Philadelphia in the early 1990s, and so he has experience with essentially children dying from measles, and he really contained it, the outbreak in Philadelphia. So he's been committed to working to address vaccine preventable infections in kids for a long, long time. And he really does a lovely job. Here's just a short piece about the scientific method. It seems that a lot of people, I think, or the lay public, just don't quite understand the scientific method. And I think that confused people during COVID. You know, as the pandemic progressed and the information we gained kind of furthered our understanding of the infection and transmission, then our recommendations changed, and I think the lay public was confused by that. So in some ways, it seems that whatever we can do to help the lay public better understand the scientific method may be helpful here. I love the quote. I hope you guys like the quote too. But, you know, anyone who rejects the benefits of science and the scientific method should toss away their smartphone, stop using the internet and social media, never travel on an airplane, and ignore medical advice to treat their ailments. All these societal benefits and advances are grounded in the very concepts rejected by those attacking science. I think it's a lovely, it's a lovely quote. All right, so our third question. So what actions can we take to support science, medicine, and public health? I'd like to come back here to the physician's pledge. We just said this at convocation. We'll say it at the white coat ceremony. At Carle, Illinois College of Medicine, we use the World Medical Association Declaration of Geneva. And this is how it starts out. As the member of the medical profession, I solemnly pledge to dedicate my life to the service of humanity. And then it goes on. Do you use this pledge here too, or one like it perhaps? Yeah. It's beautiful. I don't know about you guys. I get a little teary-eyed as we're saying this. I mean, it's just so deeply meaningful that this is what we do. This is what we do. So when we think, well, what does that mean, to the service of humanity, right? These are some of the thoughts that came to my mind. But excellence always, right? To be curious. We want to understand our patients, understand the problems, understand the research questions. We're going to seek to understand and to listen, seek to console patients, and also to be trustworthy, right? To earn people's trust. This is what we do. I don't know if any of you are familiar with Paul Farmer. This image rings a bell. If you're not, I'd urge you to become acquainted. He died a few years ago, tragically, just of a heart disease. I think he was 62 years old. But he was, in many ways, a global humanitarian. He and I were in our infectious disease fellowship together, actually, at the same time. And years ago when we were at Harvard and Brigham and Women's Hospital. And he was a very outspoken and just very compassionate, dedicated physician and committed to global health. And his argument always was, for especially with global health, you know, why should people living in a country with less resources not receive the same medical care as someone living in a place with, like say in Boston at Harvard. So he worked to just make that happen. So he established a hospital in Haiti, went to Peru, and also, gosh, in Russia, and then in Africa, all around the world. At any rate, there's a lot of wonderful things you can read about him. But there are some of these quotes which I think are relevant to what we're talking about here today. You know, one of the things that he's known to have said is counter failures of imagination. To me, certainly with Carle Illinois College of Medicine, this is key for us, right? We can imagine, there's all kinds of things we can imagine, and we don't want to cut our imagination short. There are things that we can do, things that we can accomplish. Harness the power of partnership. And part of our partnership today, NYCU, UIUC, Carle Illinois. And then, and he's speaking as a physician here, trust must be built one patient at a time. And with this community, communication, reaching out and all this. His PhD was in anthropology, and that was his background. He's just an inspiring human being. If you Google him, you'll find a lot about him. There's a book that Tracy Kidder wrote about him, Mountains Beyond Mountains, and that's kind of a nice summary of his life, and it's an easy way to kind of start learning a little bit more about him. So the question for us is, you know, what do you think? What actions can we take to support science, medicine, and public health? And this is for our medical students. How can an engineering-based medical school help? So what do you think? Yes, please. Yeah.
Thank you for and it is my opinion that most of the opposition to science and vaccination of the ability to understand the science and you mentioned a lot of articles and papers, and I don't think that the lay public is able to digest and that information documented.
Yeah.
So physicians and scientists, especially play the key in bringing through aspects of health. So because we have the knowledge required and you know what patients are thinking of, at least I hope so, I think we're better equipped to provide that information in a method that patients understand. And kind of mold that to their background and their level of education. And I think that's the way.
Yeah, thank you. Thank you for that comment. I completely agree with you. Yes. Any other thoughts or things? Any engineering-related things you think we can do?
I'll say one thing
Yes,
about
please.
engineering.
Yeah.
I think engineering is solidly built on models.
Yeah.
Okay, and then and our knowledge is not our
Yeah.
final goal, but impacts,
Yeah.
right? So how can a practice to be practical that can be applied to the public,
Yeah.
like a cell phone? Okay, that's
Yeah.
engineering, right? It's not just science. So for engineering-based medical school, I think that how we've been able to push the best medical practice, practical best practice, right? Not just the top practice, to the world actually. Yeah.
That's right. So with models and things. Yeah. Yes.
One of the things that the pandemic did is it exposed how messy research is. If you're doing research, you know that it's not linear. It is very unpredictable with a lot of starts and stops and twists and turns. And when policymakers, experts were forced to make a real-time decision on stage to the world and get it right,
we all know it wasn't going to happen. We were going to make a lot of mistakes. And that, in some sense, exposed how truly messy it is. I'm a firm believer in communication. A firm believer, and not just communicating with each other. We can all sit together at lunch and talk to each other and agree with each other. But what about the person who doesn't have an education? What about the person who is innately feeling less than the educated? Because we are privileged people. We are all in this room very privileged people. And we have to realize that most of the world isn't. And our privilege is an opportunity also for our personal lives, but also for society. And I very much believe that in everything that I do in my professional life and my personal life. My motto in life is think big, act bold, but always help others. And if we forget the last part, we create schisms that ultimately prevent us from being effective.
No, I agree. We talk about this all the time. So, I agree. Any other thoughts? Alrighty, keep going here. Here's some potential actions that we can all take, right? And I think related to the point that you made, like the first point here, to always be prepared to convey accurate scientific and medical information as best we can. And again, I love Paul Farmer's quote here, think bigger, build bigger, counter failures of imagination. You can think broadly. And there's a whole bunch of things that we can do. I won't read through all this list, but this is just some of the actions that we can take, which I think are important. Now, here's something from, kind of a data science, perhaps an engineering point of view, as I'm looking at our students here, but this is from the state of Illinois. The state of Illinois Department of Public Health has created a measles outbreak simulator dashboard. And it's kind of a neat thing. So, for instance, what you can do is you can put your county in up here, and we'll put in Champaign County there, public schools, funding type public schools, school districts, because in Illinois, the vaccination status of all kindergartners all students must be reported to the state. So Illinois can do this. Now, other states that have different requirements may not be able to do this. But then you can look here what comes up. So we have Champaign, this is our local schools, and then like Central High School and something like a middle school and an elementary school. You can see the enrollment, and then the school vaccination rate. I was surprised at how low the vaccination rates for these places were in our local community. So Central High School, so these are students who are 16, 17, 18 years old. Their vaccination rate there is 91%. Well, then what you can do with this dashboard is you come down here, you put in the school enrollment, the school vaccination rate, and say there's one student who's initially infected with measles, then the chance of exceeding 10 new infections is 30.5%, and the likely outbreak size within that school by itself is 10 to 78 cases. So it's a simple thing. You guys, our students, you guys could do this in your sleep, okay? In the sense that using the data that's available, but to get back to what was said earlier about sharing accurate information in like news conferences or whatnot, but this is one way to share simple, accurate information with the community using skills that we have to develop a dashboard like this for the public. So this I thought was intriguing and kind of a good thing to do. Now, of course, we got to go to ChatGPT. What does ChatGPT say about this? How do we rebuild trust in public health? And you can see here it's kind of, probably everything that we'd expect ChatGPT to say. Some of these things are easier said than done, of course, but this is ChatGPT's opinion, if you will. So regarding engagement, thinking back about communication, I particularly like these quotes. And the one that truly jumped out to me is this last one, that public engagement in science communication should be prioritized as a vital and essential activity for biomedical sciences. And then I added physicians. I think it's important for us as well to be prepared to do this. So that quote comes from Peter Hotez, who wrote this book. He's a pediatrician, a vaccinologist who's working at Baylor in Texas, and he's the dean of their School of Tropical Medicine and Public Health, I believe. At any rate, this book summarizes kind of the current state of affairs, if you will. But as he describes here in the book, that the vaccine hesitancy and misinformation movement, it's a piece of a much larger issue, this health freedom movement, which again probably sounds reminiscent with what we hear happening now in the federal government. At any rate, it talks about how these forces are combined, the anti-vax, anti-science, anti-expertise, and all of this, pro-natural remedies, but this is the milieu where all of this is coming from. But his book describes this well. If you're interested in this topic, I suggest, recommend that book. So another thing that we can do is go to media and public service, or media, which in my mind equals public service. My husband and I have authored a number of papers and short pieces together for the lay public to try to address questions that people may have and help raise the level of understanding. And these are just some of them that we've done. Here's one that I wrote just a couple months ago. And again, you know, the advice that I had received, I wrote this on behalf of the American College of Physicians, said, oh, write about match day. You know, it's March, it's match day, and all of this. And in my mind, I'm thinking about match day, but I'm thinking about all this other stuff. It's like, what do we do? And I realize, you know, the issue is really how do we protect our students' futures? That's what's important to us. You know, I'm as thrilled as anyone on match day and graduation when people, you know, graduate and find out where they're going. But it's like, what responsibility do we have as faculty to try to protect our students' futures going forward? So it's just an example of one piece that I wrote. And it's published on Kevin MD. It's kevinmd.com. And it was probably the first online social media site for physicians in the U.S. And so the audience here is physicians, but you know, as important as it is to talk to the lay public, it's important for us to support each other and work with each other across forums like this. Now, we know that baseball is a big thing here in Taiwan. Here's what the New York Yankees use for their communication guiding principles. And in essence, it's about building trust. This is what they do. Honesty, humility, accessibility, and accountability. And you think, my goodness, if it's good enough for the New York Yankees, it's good enough for us, right? We can use this too. So I love those. And another way to think about service, of serving others and serving the community, is these things. So whether it's opinion editorial pieces or going on the radio, TV, blog interviews, whatever it may be, these are some tips that we can follow. One thing that works really well is to tell a story. Right? If there's a little story we have that we can share, we can build around that, and that often seems to stick a little bit better. This is a book that I happened to find randomly in our public library. A few years ago now, I was invited to give a story slam at our National American College of Physicians meeting. And I thought, well, how do you tell a story? I mean, we think we know, but I wanted to see what the literature had to say about it. So anyway, I found this book, and now my husband and I are giving this book you're giving it to all your graduate students. I've given it to some medical students. You guys now know. It's a really fantastic book. It's, as we speak, how to make your point and have it stick. So how do you deliver a story? How do you speak in a way that just helps people to understand what you're trying to do and what you're trying to share? So if you're interested in this topic, again, I urge you to read this. We have copies of this book floating around at home. It's all a good thing. So in summary here, there's a lot of things that we talked about and a lot of points there, but I think I've shared with you, and you're aware, that the anti-vaccine movement is a component of this larger, really well-funded kind of anti-science and health disinformation movement, and that's a challenge for us in medicine. And then again, for public engagement and science communication, it should be prioritized as a vital and essential activity for biomedical sciences and physicians. I think it's important for all of us. And then the last one, there are many actions that we can take, and I think it's a challenge to us that we can counter failures of imagination. So to think broadly and think widely about what we can do and how we do this. So with that, I'd like to thank you, and it's a pleasure to be here. We were at, what's the name of the restaurant? Okay, yeah, no, it was yummy. It was great. It was wonderful. They say these folks look like they're making semiconductors, but they're not. They're making like dumplings. So anyway, it was delicious and really wonderful. So thank you so much. I hope this is helpful. So thank you.
Thank you so much for a wonderful talk. So that's open for the questions.